India logs 164 new Covid-19 cases in a week. Government reviews situation as new wave hits Asia. India's health ministry reviewed the situation of Covid-19 in the country after a new wave of coronavirus in Singapore and Hong Kong sparked a global alarm. The fresh wave in Southeast Asian countries is largely driven by the spread of new Omicron subvariants, including JN.1 and its related descendants. The chairpersonship of the Director General of Health Services (DGHS) has held a meeting with experts from the National Center for Disease Control (NCDC), Emergency Medical Relief (EMR) Division, Disaster Management Cell, Indian Council of Medical Research (ICMR) and central government hospitals. As per the preliminary information available, the cases are mostly mild, and not associated with unusual severity or mortality, they added. The expert meeting concluded that the current Covid-19 situation in India remains under control. News agency PTI reported. Covid-19 surge in Asia. How dangerous is JN.1 variant and are existing vaccines effective? Enemies. India witnessed a rise in Covid-19 infections, with Kerala reporting 69 fresh cases since May 12. Maharashtra and Tamil Nadu led the tally with 44 and 34 cases respectively. Over the past week, Karnataka has recorded 8 cases, Gujarat 6, Delhi 3, and Haryana, Rajasthan, and Sikkim each reported 1 case. Nan the number of active Covid-19 cases in India stands at 257. However, almost all of these cases are mild, with no hospitalization required, PTI reported citing official sources. Hospitals have been asked to monitor influenza-like illnesses and severe acute respiratory infection cases. The Union Health Ministry remains vigilant and proactive in monitoring the situation closely, ensuring that appropriate measures are in place to safeguard public health, the sources added. Nanan, India's leading epidemiologist, Dr. Raman Gangakhedkar, who was the face of the government's daily health briefings during the first wave of Covid-19 in 2020, has urged the public to remain calm, stating that there is no cause for panic unless there is a noticeable rise in hospitalizations or fatalities. He also highlighted that India is equipped with a vaccine specifically targeting the Omicron variant. Developed by Pune-based Genova Biopharmaceuticals, the mRNA-based vaccine, Govt 19, is the first of its kind to be developed in the country. If there is an unusual surge in cases, India can increase production. However, as of now, there is nothing new or alarming, he said. We must accept that Covid-19 has become endemic. The only caution for the elderly and immunocompromised individuals is to follow COVID-appropriate behavior like maintaining hand hygiene, wearing masks, and avoiding crowded places. Which countries are reporting surge in Covid-19 cases? Should you travel to these countries? And swipe left for next video. In early May 2025, Singapore experienced a significant spike in Covid-19 cases, with weekly infections jumping from approximately 11,100 in late April to 14,200 in the first week of May, a sharp 28% increase. Hospitalizations followed a similar trend, rising by nearly 30 during the same period, prompting concerns among health authorities. Meanwhile, Hong Kong is facing its most intense wave of Covid-19 in a year. The city recorded 31 virus-related deaths in the week ending May 3, the highest weekly death toll in the past 12 months. Infections also continued to climb, with 1,042 new cases reported in the week ending May 10, up from 972 the previous week. This marks a stark contrast to early March, when weekly case numbers hovered around just 33, according to official data. Latest blogs.